इंपॉर्टेंट डिसऑर्डर है, जो फर्स्ट डिसऑर्डर है अपना मिडिल ईयर का, वो है एक्यूट सेपरेटिव ओटाइटिस मीडिया. इट्स अ एक्यूट इन्फ्लेमेशन ऑफ द मिडिल ईयर बाय द पायोजेनिक ऑर्गेनिज्म. सो पायोजेनिक ऑर्गेनिजम्स है जो एक्यूट इन्फ्लेमेशन करेंगे. अब जो इधर मिडिल ईयर है, इसका मतलब है पूरा मिडिल ईयर क्लेफ्ट. सो वी नो दैट देर इज अ एंट्रम, वी नो दैट देर इज अ adytus, attic, which is epidympanum, middle ear, eustachian tube, and mastoid ear cell. So this basically acute inflammation of any part of the middle ear cleft by the pathogenic organism leads to the acute suppurative otitis media. Now ये इसमें etiology में हमें ज़्यादा पता होना चाहिए कि ज़्यादा common है infants में, children of the lower socio-economic group. Typically the disease follows a viral infection of the upper respiratory tract, but soon the pathogenic organism invade the middle ear. So it's a viral disease. तो you have to understand कि primary it's a viral infection जो हमारी superimpose कर देता है, superimpose by the bacterial इन्फेक्शन. तो हमारे पास पहले तो वायरल डिजीज़ होती है, और ये वायरल डिजीज़ क्या करती है, कन्वर्ट हो जाती है अपनी सुपर इन द बैक्टीरियल इन्फेक्शन. दैट इज वायरल इन्फेक्शन ऑफ द अपर रेस्पिरेटरी ट्रैक्ट इज कन्वर्टेड इनटू द बैक्टीरियल इन्फेक्शन बाय द पायोजेनिक ऑर्गेनिज्म. अब आता है रूट्स ऑफ इन्फेक्शन. जस्ट हमें इतना पता होना चाहिए, ढींगरा में बहुत ज़्यादा दिया है, बट वी हैव टू नो दैट वाई यूस्टेशियन ट्यूब. मोस्ट कॉमन रूट हमारे यूस्टेशियन ट्यूब से है. वी हैव द एक्सटर्नल ईयर ऑल्सो एंड वी हैव द ब्लड बॉर्न ऑल्सो. ब्लड बॉर्न इज अ वेरी अनकॉमन रूट, ज़्यादा हमारे यूस्टेशियन ट्यूब से होता है, विच इज़ अ मोस्ट कॉमन रूट. जो इन्फेक्शन है ये ट्रैवल करती है ल्यूमन ऑफ द ट्यूब अलॉन्ग द subepithelial peritubal lymphatics. Eustachian tube जो infants, very important, eustachian tube in the infants and young children is shorter, wider and more horizontal, thus may account for the higher incidence of the infections in this age group. That's why ये ज़्यादा young children में ज़्यादा होती है. The reason is this, क्योंकि हमारी eustachian tube shorter है, wider है and more horizontal है. Breast or bottle feeding in a young infant in the horizontal position may force the fluids through the tube into the middle ear and hence need to keep the infant propped up with the head a little higher. We know that कि eustachian tube हमारे anterior wall of the middle ear में उसकी opening है. One is in the nasopharynx. It has one opening in the nasopharynx that is behind the inferior turbinate, posterior end of the inferior turbinate, and one opening is in the anterior wall of our मिडल ईयर. सो उसी तरह दैट्स वाई हमें याद रखना है कि स्विमिंग एंड डाइविंग कैन ऑल्सो फोर्स द वाटर थ्रू द ट्यूब इन टू द मिडल ईयर. सो जब सबसे इंपॉर्टेंट है कि यू हैव टू अंडरस्टैंड कि दिस इज एक्यूट इन्फ्लेमेशन ऑफ द मिडल ईयर होता है, जो मिडल ईयर लेफ्ट में है. देन द इटियोलॉजी इज दैट कि इट्स इन्फैंट चिल्ड्रन में एक्सेप्शनली ज़्यादा है, ज़्यादा ये वायरल इटियोलॉजी का है. दैट इज सुपर इम्पोज बाय द बैक्टीरियल इन्फेक्शन विच विल सी दैट इज यूजुअली स्ट्रेप्टोकोकस pneumonia. And what is the other thing is by external ear traumatic perforation, if there is any perforation of the tympanic membrane due to any cause open a route to the middle ear infection. So any perforation, congenital perforation is there, or any surgical trauma is there, जिसकी वजह से external ear में चली जा सकती है. So this is blood-borne is very uncommon route. Now this is important. What is the predisposing factors? So if you have to write in the paper, you have to write like this: acute suppurative otitis media, etiology, routes of infection, predisposing factors. Of course, predisposing factors है, of course upper respiratory tract infection तो आएगा ही आएगा. Recurrent attacks of common cold हमारे पास आ जाते हैं. We have the fevers like measles, diphtheria and whooping cough, जो हमारे पास प्रीडिस्पोज कर देता है इस चीज़ को. इन्फेक्शन ऑफ द टॉन्सिल्स एंड द एडिनॉइड्स ऑल्सो, बिकॉज वी नो दैट कि हमारी टॉन्सिल इज इन द वेरी क्लोज नियर द यूस्टेशियन ट्यूब, सो द any infection from the tonsils can go there. Then the chronic rhinitis, the sinusitis, nasal allergies, tumors of the nasopharynx, packing of the nose. This packing of the nose जब हम करते हैं in the epistaxis during, so it has been required कि अगर we are doing the packing, we have to hospitalize the patient and antibiotic cover has to be given. So packing of the nose, maybe if there is any bacterial infection, so that can cause this one, nasopharynx for the epistaxis and in the cleft palate. Next is important is about the bacteriology. अब हम देखते हैं कि what is the bacteriology. Most common cause in the infants and young children, very important, you have to write. It's a viral infection but superimposed by the bacterial infection, in which streptococcus pneumoniae, which is responsible for the 30%. Now Haemophilus influenza, which is going to cause the 20%, and we have the Moxella catarrhalis, which is going to cause the 12%. And there are some other organisms like Streptococcus pyogenes, Staph aureus, Pseudomonas aeruginosa, and about 80 to 20% no growth is seen. Many strains of H influenza, Moxella catarrhalis are the beta lactamase producing. That's why हमें बहुत ज़्यादा which type of the antibiotic has to be given if they are infected by this type of the bacteria which are beta lactamase producing. So next is very important, very important is this one कि what is the pathology and what is the clinical features of this stage. कि हमारी pathology क्या रहेगी और clinical features क्या रहेंगे. So there are, first is a stage of the tubal occlusion, there is a stage of the pre-suppuration, there is a stage of the suppuration, then there is a stage of the resolution, and then there is a stage of the complications. So in the acute otitis media, you have to first remember these 5 states, and in her state mein what is the symptoms and signs, we have to know this. Let's start with the stage of the tubal occlusion. Tubal occlusion, that is a eustachian tube occlusions. Whenever there is edema is there, hyperemia of the nasopharyngeal end of the eustachian tube blocks the tube, leading to the absorption of air and the negative intertympanic pressure. Of course, there is a eustachian tube, and when it gets blocked up, there will be negative pressure. It will lead to the collection of the fluid inside the middle ear. Of course, there will be the retraction of the tympanic membrane. We will see that grade 1. That is a grade 1 Sades classification of the retraction of the tympanic membrane, in which there is foreshortening of the handle of the malleus, distorted cone of light, sickling of the malleolar folds. So these are the features, and we have the prominent lateral process जो हमें वो type की signs भी मिल सकते हैं if you do the on examination that you see. So just you will see there is a slight retraction of the tympanic membrane also क्योंकि एक negative pressure है with some degree of the effusion in the middle ear, but the fluid may not clinically appreciable. So in this there is only the सबसे पहले हमारी stage आ गई eustachian tube की occlusion. सबसे stage आ गई eustachian tube की occlusion, but of course negative pressure develop हो रहा है, slightly retracted हमारी tympanic membrane, but it's the fluid that is deposited, it's not clinically appreciable. Very important are the symptoms. The symptoms are the deafness and earache are the two symptoms, but they are not marked. But there is generally no fever because there is no suppuration right now, so fever nahi hoga. Signs and tympanic membrane is retracted with the handle of malleus assuming a more horizontal position, prominence of the lateral process of the malleus, and loss of the light reflex. That is just जो हमारी tympanic membrane की retraction की वजह से sign होते हैं grade 1. These are, and tuning fork test shows the conductive deafness. After that there is a stage of the pre-suppuration. Stage of the pre-suppuration में now it's important कि अब tubal occlusion is prolonged, pyogenic organism invades the tympanic cavity causing the hyperemia of the lining, inflammatory exudates appears in the middle ear, and tympanic membrane now becomes congested. अब जो tympanic membrane है वो हमें congested मिलेगी, and here we have a very special name, like we'll see the blood vessels that is called as a cartwheel appearance of the tympanic membrane. Cartwheel appearance of the tympanic membrane. Appearance of the tympanic membrane. So cartwheel appearance of the tympanic membrane. There is marked earache which may disturb the sleep and a throbbing and of throbbing nature. Deafness and tinnitus are also present, but complained only by the adults. Usually child runs high degree of the fever and restless. And is restless. That is the stage of the pre-suppuration. Sign is very important. The sign basically इसमें आपको याद रखना है cartwheel appearance, which is going to occur in the pre-suppuration stage, in which the blood vessels appear along the handle of the malleus at the peri of the tympanic membrane, imparting it's a cartwheel appearance. Later, whole of the tympanic membrane, including the pars flaccida, becomes the uniformly red. And cuneiform test will show the conductive type of the hearing loss. Now, the next stage is called as a stage of the suppuration. It is marked by the formation of the pus in the middle ear and is some extent in the mastoid ear cells. Tympanic membrane starts bulging to the point of the rupture. Now at this stage we'll say that the fluid will get deposited and lot of there can be bulging of the tympanic membrane, you can see, and there is a pus which is present, and earache has become excruciating. Difference increases. Child may run the fever of 102 to 103 degree Fahrenheit and is accompanied by vomiting and even convulsions. So signs are the tympanic membranes appear red, the bulging with the loss of the landmarks, it's there, and handle of the malleus may be engulfed by the swollen and protruding tympanic membrane and may not be discernible. And a yellow spot may be seen on the tympanic membrane where rupture is imminent. That is, rupture has to be there. And in the pre-antibiotic area, one could see a nipple-like protrusion of the tympanic membrane with the yellow spots on its summit. Tenderness may be elicited over the mastoid antrum. And you have to say that if there will be any perforation of the tympanic membrane, there is bulging, so there is a sign which is called as a pulsatile otorrhea. There will be the pulsatile otorrhea will be present, and this pulsatile otorrhea will represent lighthouse sign, which represent the lighthouse sign. It's the sign that is called as a lighthouse sign. X-ray of the mastoid will show the clouding of the ear cells because of the exudates. Now we have the state of the resolution. Now of course, now if the immunity is there, that is tympanic membrane rupture with the release of the pus and subsidence of the the symptoms, okay, and inflammatory processes begin to resolve. If the proper treatment is started early, or if the infection was mild, resolution may start even without the rupture of the tympanic membrane. Now in this, there is evacuation of the pus, so there will be earache will be relieved, fever may come down, and child feels better. External, of course, there will be the perforation which has occurred right now, but the perforation which occurs is usually a central type of the perforation. External auditory canal may contain the blood discharge which later become mucopurulent. Usually a small perforation is seen in the anterior-inferior quadrant of the pars tensa. Hyperemia of the tympanic membrane begins to subside with the return to the normal color and the landmarks. After that, if there is low lack of immunity, and which can goes to the sign of the complication. Basically, the sign of the complications of the otitis media, we'll see that they are similar in each type of otitis media if they are not resolved. Because if recurrent acute otitis media is not resolved, it can go further progresses to the CSOM. It can go in the chronic suppurative otitis media. So recurrent ASOM, that is acute suppurative otitis media, or unresolved ASOM, it can goes into the stage of chronic suppurative otitis media. In the stage of the complications, a big chapter, जो stage of the complication पे है, it's a very important chapter. That was that is, if the virulence of the organism is high or the resistance of the patient is poor, resolution may not take place and disease spreads beyond the confines of the middle ear. It may lead, now we have to say complications है, या तो वो intracranial complications हो सकती है, या तो वो intratemporal हो सकती है. Intracranial मतलब extratemporal, intratemporal मतलब वो है हमारी extracranial. अब now like we have the acute mastoiditis, this is basically the intratemporal complication with the subperiosteal abscess, that is, this is subperiosteal abscess is an intracranial. Where the facial paralysis, again it's intratemporal. Labyrinthitis, petrositis, these are the intratemporal. Where the extradural abscess, there is extradural abscess which is intracranial. Next, meningitis intracranial, brain abscess is an intracranial, lateral sinus thrombophlebitis is an intracranial, and depend करता है कि which type of brain abscess will be there, and lateral sinus thrombophlebitis, and which type of there will sign you will see, that is Pickett-Hens type of the fever. That is a very important sign for the lateral sinus thrombophlebitis. Now is a treatment may just remember you have to give the, firstly, if individual is coming, you have to go with the antibacterial therapy to the individual. You have to provide the decongestant nasal drops. You have to provide the oral nasal drops. Then for the pain, we can provide the analgesics. For the fever, we can get antipyretics. If there is a discharge, pus release in the ear, we can go for the ear toileting. And we have for the pain, okay, that is to help to relieve the pain, we have the dry heat. And in the cases of the impending perforation, there are some perforations which are not now have not occurred. That perforation has not occurred, but they have to occur. We go for the impending perforation, and for the impending perforation, we are going to have the process, like laryngotomy, which is an OPT procedure done with the help of the laryngotome. And then this, a very curvilinear incision is made into the quadrant, so it's a very curvilinear incision which is made into the anterior inferior quadrant of the tympanic membrane. So curvilinear incision is made on the anterior inferior quadrant of the tympanic membrane, and it resolves on its own, and the pus is being drained out. So it says that it says that when it's indicated, so the drum is bulging and there is acute pain, there is incomplete resolution despite the antibiotics, and there is persistent infusion beyond the 12 weeks. Now all cases of acute suppurative otitis media should be carefully followed till the tympanic membrane returns to its normal appearance and conductive hearing loss disappears. So this is a very important table. अगर हम देख ले, like we have to start with the acute, there is acute otitis media, हमें उसको antibacterial therapy देनी है, like of course that depends upon ना, or we have the different types of the antibiotic therapy जो हम antibacterial therapy देंगे, like against the streptococcus pneumoniae, hemophilus, ampicillin, amoxicillin. Then the beta lactamase के लिए we have the special drugs, amoxicillin, clavonate, augmentin can be given, and these type of the drugs can be given. Now decongestant we know. Now just remember, we have the antibiotic therapy, then we have to review after 48 to 72 hours. Next, if there is a earache or fever persist or increase, other antibacterial therapy for the 10 days, or myringotomy if it's an impending perforation क्या perforation होने वाला है. You can see that yellow bulging sign in the suppurative stage, and this is the thing that is basically the myringotomy is usually done in the stage of the suppuration when the tympanic membrane is fully bulging. And culture and antibacterial for 10 days, the good response continue for the same days, complete resolution होगा. Next is persistent fluid earache, and there can be the complete resolution हो सकता है. अब there will be the complete resolution, there can be persistent infusion. If there it has to, if there is a persistent infusion and if not it has not resolved for up to 12 weeks, अब 12 weeks तक वो चीज़ हमारी नहीं resolve होगी, now we have to treat it as the acute, that is we have to treat that disease as otitis media with the effusion. Now that we have to treat as the otitis media with the infusion, otitis media with the effusion, or the serous otitis media. Of the serous otitis media, treat as otitis media with the effusion. So this was about ज़्यादा हमारे पास इस पे अगर नोट आ जाता है, just we have to write about what is acute suppurative otitis media, we have to write about the etiology, roots of the infection में just ये हम बता सकते हैं कि what are the predisposing factors क्या है, we have to know it's a viral disease which is a